सर आपने सपोर्ट सिस्टम की बात की
जी,
यूथ के लिए कि उनका सपोर्ट सिस्टम अच्छा होना चाहिए। तो आपने मानसिक शक्ति फाउंडेशन जो जिसके आप
जी,
फाउंडर हैं,
जी।
तो ये कैसे यूथ को ये कैसे सपोर्ट करेगा ये फाउंडेशन उनकी मेंटल इलनेस को या हेल्थ को कैसे सपोर्ट करेगा?
मैं आपको बताता हूँ कि ये पूरी प्रक्रिया कैसे शुरू हुई। जब मैं हमने कनाडा में हमें इंडियन हाई कमीशन ने अप्रोच किया कि दे वांटेड टू एस्टैब्लिश ए सर्विस फॉर स्टूडेंट्स हू गो फ्रॉम इंडिया टू कनाडा। उसमें बहुत से बच्चे उदास, निराश और बड़ी उनको मानसिक तकलीफ होती।
हुँ,
तो हम लोगों ने मिलके वो सर्विस वहाँ एस्टैब्लिश की। उसका नाम है सहयोग.com। उसके बाद हमारे जो मित्र लोग थे कनाडा में, उनका ऐसा विचार आया कि वी शुड गो टू लखनऊ एंड डू समथिंग। वो विचार कहाँ से आया मैं नहीं जानता, बट वी केम हियर and we met the local psychiatrist and chief psychiatrist, older teachers and all, and we expressed that, sir, my friends, we need to do something. Then we started 4 days seminar every month online for training people, say teachers or social workers, what to do about suicide, etc.
हुँ,
Gradually, we realized that this is too much of dose, and we cut it down to 1 day or 2 day. That was the period when I was going around to various universities and meeting academicians, thought leaders, students, teachers, vice chancellor, etc., etc. And what I learned, apart from that, I have worked lifelong with the student population, whether in Mumbai or in England or in Canada. I was working in even in Brunel University in London and looking after the mental health clinic, and same working with First Episode program in Canada. So it's not a my concern for young people is not new. It has been there, and so when we got this opportunity. But I remember the common dialogue which every thought leader or educationist said that, doctor, you are talking good things. We realize that there is problem, but we don't know what to do.
हुँ,
So we started thinking, how can we help in this situation? And we came to know that the first thing is that we should be able to identify who is potentially having problem and who is likely to have problem. Now, this is known as a method of screening. In our country, it has been practiced in a few institutions where um, all students were screened whether they have a mental health issue or not. We started thinking differently that what can we do so that we can find out. So there are three, four principles that we adopted. The first, we said that our students need to be empowered. अभी क्या होता है कि किसी भी बच्चे को कोई प्रॉब्लम है और उसने घर में कहा, और अगर पिताजी ने कहा नहीं नहीं ये कोई बात नहीं है, आप आराम करें, सो देन इट इज शन डाउन, यू ही कैनॉट गेट एनी केयर. Or sometimes it is reverse, that the child does not have problem and the parents are worried because of prevailing culture. Sometimes teachers come to know because they are the best counselor and they are the best observant, because most of the time a student spends in college. So their teacher is, they know everything, but their attitude comes in the process, in the way of seeking care. So due to number of reasons, and of course because of stigma, the student, despite knowing that they may have difficulty, they do not seek help. In fact, in our country, 8 out of 10 people suffering from a mental health issue do not get a treatment. Even if the treatment is available, they do not go there. Now, if this is the situation, what can be done? So, our thought was that if our students are empowered that they can take their own decision, but for taking that decision, they must know what is normal, what is abnormal. So, we then started doing our research and kind of discussion and workshops to design psychological tests. Because, so one, we thought we must empower them. Second, we thought that we must create something so that they can test by themselves. Like you can test your blood sugar, you can take your own blood pressure. We started thinking that what about the methods so that they can test their mental difficulties by themselves. We know in our science that psychological tests are valid method of doing and self assessment. But these tests which are available are mostly from Western culture. So we decided that we will create our own set of tests. We'll go through the process of research and create something which our students can easily manage. But when we were thinking about it, we thought that a human being needs to be looked at from different perspectives. For example, you may have certain challenges, but you do have number of strength. So if you have very little challenge, your strength will counter it, will take care. So if I do the test that what are your challenges, I mean whether you have stress or mental health symptom alone, it may not be that helpful. And if we have tests which measures your capacity to respond to stress, your level of functioning, your level of well-being, your positivity, sense of positivity, these traits, these characters would also define your ability to deal with the mental health issues. So then we developed a set of 7 tests, and so there are 3 tests, 2 tests which measure source and severity of stress. There are 3 tests which are testing mental health symptoms and risk, and there are 2 tests which measure level of resilience and positivity and level of functioning and well-being. So this becomes a whole package. No matter, I mean, I accept that this is time taking. It takes about 15 to 20 minutes for a student to complete more than 100 questions. But I did not agree that we cut it down and trim it, and we don't get that information that we want to tap. Because if somebody has frank symptoms, you can see it very easily. But if somebody has minor symptoms, you have to be very thorough in your investigation. So we developed that. We, along with my colleagues, we did research to see whether it is valid, credible, and we also did research to see if a student is examined by a psychiatrist and he does the test from the app, what is the difference. So we tested it from many types, and then we digitalized it in order to take it to every person. And what I really aspire that out of 4 crore students, each one of them should have access to this test. That means they should know about the mobile, they should know about the web app, and whenever they feel distressed, they should feel free to go and test. Now, what does it do? The test gives them 2 kind of information. One, it can tell whether you have any abnormality. That means whether you have any symptom of a mental disorder. It does not give a diagnosis. Diagnosis is work by a qualified psychiatrist. So we not touching on that. Whether you have possibility of developing a mental health problem, that's the job of screening, and that's what we are doing. So the student will come to know whether there is any tendency or serious stress or symptoms are present or not present. The second part of the report is that it informs you what should you do. Whether you need to connect with a counselor, whether you need to connect with a psychiatrist, or whether you need to change your lifestyle. Whatever is the requirement is indicated in the report. And we then encourage that please take this report home and discuss with your parents. We also guide that where do you get the counselor from, where do you get the psychiatrist from, what is their role, how are they going to help you. All this is reflected in the report. And the best thing has happened. You see, Government of India has started a facility which is known as eSanjeevani.
Okay.
You go there, you log in by your Ayushman Bharat ID, and you can get a free consultation of all facility, all specialty, be it cardiology, be it psychiatrist, whatever. So we are directing the students to that demand, because I don't want to create a force of professionals and tell them you connect. Our principle is to utilize the existing services in the country to help students.